one. And without further ado, patient-centered care, psychosocial complications of receiving a cancer diagnosis and treatment during the pandemic with Justin Yopp, PhD. Dr. Yopp, welcome.
Hey, Tim, thanks so much for having me.
Absolutely. And we've got all kinds of information about you here. I'll say Dr. Yopp is a clinical psychologist and associate professor in the Department of Psychiatry at UNC. He's a member of the UNC Comprehensive Cancer Support Program at the North Carolina Cancer Hospital, where he provides inpatient as well as outpatient assessment and therapeutic services for children and adolescents with cancer. He also works with children whose parents have serious medical illnesses such as cancer. His research is in the area of children's adaptation to cancer, and we'll let anyone who wants to get into more detail read that second paragraph. Dr. Yopp, what's one thing we should know about you outside of your professional bio there?
Oh gosh, outside my professional bio,
Yeah, yeah.
I don't know what to say about that. I've been here at UNC for 13 years. I'm actually born and raised in the Triangle. Left for a little while, and fortunate enough to come back. And even though I'm a diehard Wolfpacker, I'm happy to be here at UNC.
Great, great. Well, we are thrilled to have you here today. I mentioned poll everywhere, and hey, this is all anonymous, so we're not going to be tracking anyone's answers if that helps people feel more comfortable with this. The first one, does the pandemic continue to play a role in psychosocial complications for cancer survivors? This is a yes or no. Let me go ahead and read the disclaimers, and then folks can go ahead and fill that out, take their best guess on that. This activity has been planned and implemented under the sole supervision of the course director, William A. Wood, MD, MPH, in association with the UNC Office of Professional Development. The course director, CPD staff, and CPD staff have no relevant financial relationships with ineligible companies as defined by the ACCME. The University of North Carolina at Chapel Hill is accredited with distinction as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. A potential conflict of interest occurs when an individual has an opportunity to affect educational content about healthcare products or services of a commercial interest with which she has a financial relationship. The speaker and planners of this learning activity have not disclosed any relevant financial relationships with commercial interests pertaining to this activity. Whew. All right. And with that, we have
Shocker.
looks like a shocker. Who would have thought, right? The audience is definitely paying attention. And with that, we'll turn it over to you. Psychosocial complications of receiving a cancer diagnosis and treatment during the pandemic. Dr. Yopp, it's all yours.
Thanks so much, Tim. And I remember thinking this morning when you first invited me to give this presentation. It was in, I think, February. And it's remarkable how different that presentation would have been then as it is now, and as it would have been 2 years ago, and it might be again in 6 months from now.
Oh my gosh.
On where this goes, which of course none of us know.
Yeah.
But thanks so much for having me. I really appreciate it. I'm glad to have everyone here today and a little chance to share, and I hope that it's helpful. So let's see. Hopefully I have control, which they've given me for these slides. And there we go. All right, so real brief disclosure for me. I co-authored a book that was published some years ago. It has not really much to do with this talk today, and all our royalties go back to Lineberger anyway. I thought you were going to pause me on the disclosures and slap me on the wrist for something, but I'm glad it wasn't that. All right, and so as I said in the bio, and I have to admit that bio that I gave to Tim is a little bit outdated. I used to do most of my work on children and adolescents, and over the years that shifted to where now I probably do maybe a quarter to a third of my work with pediatric population and most adult population here at UNC. And I am a member of the CCSP, which hopefully a lot of you guys know about. If not, briefly, we are located here, of course, at UNC. We are made up of a wide variety of different specialties and backgrounds, including, really including a lot, but the bread and butter is mental health services, whether it be with psychiatrists, psychologists like myself, master's level counselors, lots of social workers. And really that is our primary mission here at UNC, is to take care of the mental health, emotional needs of our cancer patients. And I can probably assume that most people on this call understand why people like us have a job at a place like this. All right, so here is the first poll question. I have three of these. It's the first one I put in here. So real quick, this is kind of it's a little bit of a trick question, maybe. I'm not trying to trick you, but I realize it kind of is. But what percentage of patients with cancer, being treated for cancer, experience psychological distress? All right, so this is good. This is about what I think I expected, and that most folks think that the percentage of patients who treated for cancer that have psych distress is pretty high. And so the kind of trick question of that is that the data show, and then, of course there's research studies on this, and the data show that only about 21% endorse clinical levels of depression or anxiety. But that's a highly misleading stat, and I think my experience, everyone here's experience, is much more in line with what people answered there in the poll everywhere question, and that's that what may be considered subclinical distress, or distress that may not meet criteria for a major depressive disorder or a diagnosis of an anxiety disorder, is present in not literally every patient, but you don't have to search too hard, right? And so I think the answers that we're given mirror a lot of what I see and what we see. And again, real quickly, the sources of distress are numerous and a lot more than I could fit on this one slide, but just to highlight a few, and you can imagine the physiological changes that come with sometimes with the diagnosis, and often of course with the treatment itself. Big change in roles, responsibilities, routines, whether it's having to be less productive at home, work less. If you're a parent, kind of pass the baton more to your spouse if you're not feeling well, whatever it would be, whatever life you had, whatever routine or schedule you had before cancer. For most patients, this is going to look a lot different, of course, during treatment. Financial stressors is a very real thing that a lot of our folks deal with. And of course, existential distress, right? And I think for a lot of folks, that's kind of what it comes down to. In fact, I'll sometimes ask patients who I see for therapy that, if they knew, if they had a crystal ball, that they would survive this, their cancer, and would live to be 92 years old, it would make going through all the turmoil and all the side effects and all the upheaval of the cancer treatment experience a hell of a lot easier. And sorry to everyone for the audio problems and disjointed start. So maybe I'll catch up a little bit here. All right, so again, just kind of background on some psychosocial distress among cancer patients. Some of the main issues that I see in my therapy, work with folks, and these, again, this is not meant to be an exhaustive list at all, but you can see that kind of the initial why me, how did this happen, trying to remain autonomous, but needing to be dependent on whether it's medicine or caregivers for help, or whatever situation may be, body image, feeling like you're a guilt or feeling like you're a burden to others. It's amazing how often I hear that. I don't have a percentage to give you, but that is such a common thing. And whenever I happen to talk to caregivers, of course, they don't think of that at all as a burden. But that is not quite a universal dynamic, but it's extremely common. And this kind of loss of an assumed future, I think that's something that's probably not always appreciated. And that's that, we all kind of have an idea, or at least a general map of how we think our life's going to unfold and how it's going to go. And when you are told you have cancer and you start your treatment, that assumed future is completely disrupted and put into question. And so it's not just kind of a loss of what you don't have anymore, but a loss looking forward as to what you thought your life was going to look like. And of course, I already mentioned, if anyone could hear me, but the existential distress question, and that's what it comes down to, of course, for a lot of folks. So that was all true before COVID-19, right? That was all kind of what we did when a worldwide pandemic was not on the table. And I don't know about you guys, but there's a few days that stand out for me. I think we can all probably go back in our mental calendars and kind of think of like days that the pandemic felt real. The first one we leave was March 2nd, and that's when we had kind of our big national meeting that we go to and that we always went to, and that was the day that we were told that it was canceled. And I thought, holy cow, like canceled? What is this? You know, I've heard about this COVID thing in the news, but that made it feel more real. And then it was, of course, on the 11th. I think for a lot of folks, it's a day that it felt really real. I think that was the day Tom Hanks got it. My kids' the school started getting disrupted. And then on the 13th, I was told to pack up my office that afternoon because I might be gone for a week or two. And of course, that week or two it turned into what we're still going through 2.5 years later. And I don't know. I'm hearing someone can't hear me.
All right. Well, nice to talk to you guys on the phone today. All right. So let's move on. All right. And so, of course, for everyone that works at the hospital, you know, that was a traumatic time for everyone. I personally was home for about 2.5 months before I started to phase back in slowly into the hospital. And I know everyone, depending on how essential your work was to being on site or wasn't, really had different experiences, but a different world to say the least. And so here, of course, societal changes, nothing up here that everyone doesn't already know. But this really is the background. If you think about for folks who had already been diagnosed with cancer and were going through their treatment, life was already upturned completely. And now the whole world is on top of that, right? So social isolation, everyone's switching to a virtual world, an economic upheaval to say the least, increased mental health problems, which you've probably seen documented in the press, especially with children, but certainly not just with children. But that isolation, the shift from a normal routine, just the scary and threatening news coming on the airwaves every day really had an effect, of course, on everyone, whether it had a huge effect or a moderate size effect. I think it probably affected us all. And the racial disparities are magnified, right? They were already there, and there, of course, is research to show that those racial disparities that existed, in February 2020 only were magnified in the ensuing months. Cancer care delivery in 2020, right? Delays in diagnosis, delays in treatment, of course, because you were told not to come to the hospital unless it was an absolute emergency. Even when you did come to the hospital, strict restrictions. I remember when I first started coming back in May or June, and it was like get into Fort Knox coming into this place, right? And it was at that point a no visitor policy. And I had several inpatients who I was working with who could not see any loved ones, including one gentleman who was toward the end of his life. And it was heartbreaking to say the least. And this shift in cancer care delivery was that I think we all know about. There has now been, of course, data to support that, right? Outpatient, compared to the year before, outpatient cancer clinic visits were down 70%, screening rates way down as well, enrollment in clinical trials down by about a similar percentage. And so along with everything else in this country and in most of the world, the way people received and accessed cancer care was almost completely put on its head. And so it probably comes again as no surprise that there was a higher level of psychosocial distress in cancer, and a lot of very entrepreneuring researchers were on top of that and published some data either late in 2020 or early in 2021 that shows that patients receiving active cancer treatment had higher anxiety about COVID and had higher rates of intrafamily distress than people who did not have cancer, right? And if you had advanced cancer, then you faced unique challenges, some of the ones we just described due to hospital restrictions, access to care. and even cancer survivors, right? So folks who were not receiving active care reported increase in anxiety, hopelessness, depressive symptoms, even more so than the general population. So COVID affected everyone. I think these data show that it's fair to say that it affected folks in the cancer world even above and beyond what it did the general population. And of course, this is back in 2020. All the data that I'm highlighting here was from, what, a year and a half ago, 2 years ago, which seems like, well, 10 years ago to me. I don't know about you guys. A really interesting kind of dynamic happened in a lot of my therapy work in the early months and even into 2020 during the pandemic, and that there was some parallels between people's cancer experience and then our collective experience with the pandemic. The first being, kind of you did not see this coming, of course. How did this happen? Almost an unimaginable shift. And so people would say, and I heard this from a good number of folks, that they remember when they were first diagnosed, started with cancer, they would just think, life, they would, after their diagnosis and right into it, they would comment how different life looked a month before. And that when the pandemic started, they said the same thing. In April of 2020, they said, can you believe how different it felt 2 months ago, right? This kind of sudden shift, trying to make sense of a seismic change, and kind of this toggling between looking back to how life used to be, and then of course a lot of fear and uncertainty looking ahead, right? Going through cancer treatment, kind of when is my life going to get back to normal? And I think that's a question a lot of us asked during the pandemic: when is life going to get back to normal? Thinking about hoping for the best, thinking about fearing the worst outcomes. And then, of course, this kind of buzzword, as it turns out for this talk, is kind of this existential distress. Cancer is a threat to your life. COVID was obviously a threat to all of our lives. And, of course, the main difference in COVID and cancer is that cancer happens, on an individual basis, right? And so when people are diagnosed, they're the ones who have to take precautions. They're the ones whose worlds are rocked. They're the ones who will look, see people walking around the sidewalk and think, how can life go on normally for everyone else because I feel so different? Whereas COVID was more of a collective experience, right? We were all isolated. We were all in our homes. We were all watching the same, we weren't all watching the same news. We were all watching news, maybe getting different information depending on what you were watching, but we were all watching. It dominated all of our lives, right? It was what everyone was talking about. And so while there were, of course, some parallels between an individual experience with cancer and our collective experience with COVID, there are obviously a lot of differences. And then I think, we kind of got into 2020 and into 2021, and masks became ubiquitous, and we transitioned into a kind of a new normal that never felt normal, in a way that I think a lot of patients with cancer transition into a new normal with their lives that never really feels normal either. Vaccinations, of course, came on in very late 2020, early 2021. And I don't know about you guys, but that kind of seemed like a real beacon of hope. And of course it was. But I think maybe to some folks, self included, it seemed like that would be not kind of the cure, the end of it, but it would be universally received and kind of put us on a much different course. And while it has, it's not like 2021 was a walk in the park, right? Somehow COVID became and continued to be highly politicized. What was at first kind of demand for the vaccine, right? People wanting to get it as early as possible. You can remember there was the whole, you have to wait until your age range, or if you met certain comorbid, criteria until you could get it, but there was a real rush to get it. And pretty quickly that came in to be that everyone who wanted it, most of us got it, and there was a vaccine surplus. So that really shifted. Science and facts were questioned. Of course, the Great Resignation, right? A lot of people, more people stopped working their current jobs voluntarily in 2021 than any year ever in history. And all of that is to say that is kind of the backdrop for our society as we were going through it in 2021. And of course, patients and with cancer, and us as providers of folks to, providing care to people who do have cancer, that was our reality too, right? That's what we were experiencing. That's what we were going through. And it would be, it would be nice if none of that backdrop affected us. It would be nice if the politicalization of it didn't impact us. It would be nice if burnout wasn't a thing at work. It would be nice if that wasn't true, but it was, and still is. And that affected patients, and it does. And all, of course, this is just, like I said, the backdrop. COVID, here's where we are now. That big, tall spike is about when Tim asked me to give this talk, when it seemed like everyone was catching COVID. Thankfully, a lot of people were vaccinated, so the toll wasn't as magnified, of course, as it would have been a year earlier, but pretty remarkable how common COVID was 6 months ago and how it's starting to be again here lately. All right, so that was a walk down a terrible memory lane for the last 2.5 years. But now here we are, August 2022. It's been basically almost 2.5 years of this. And, is this the new normal for now? Is there a new normal? Certainly you can, people wearing masks in the hospital, of course, is mandated, but anywhere else, you don't see a whole lot of masks. You don't see a whole lot of precautions being taken. So is this the new normal? Are we back to normal as a society? If I had that answer, I would be making a lot more money than I do. So let me ask you this, and here's the next question. To what degree, this is not at work, so not for your clinical work or your research work, but just in your home lives and your kids and your family's lives, to what degree do you currently practice COVID safety measures? And I kind of figured that pretty easy to guess the earlier answers. I'm actually curious about this one to kind of see how it plays out. Okay, so it looks like we've kind of settled on that, and interestingly, it's pretty evenly distributed. With, I guess, looks like maybe most people kind of somewhere in the two middle ones, but I gotta put on my glasses for this. It looks like of the people responding, 87% say that they practice COVID safety measures at least somewhat, and over half people say that they are at least pretty active in their COVID safety measures. And so that's, I guess, about what I was kind of expecting. And I don't know this, but I would bet at least a little bit of money that these results reflect kind of the 100 people or so that are on this call, and that you're all professionals in the healthcare field. I would imagine if we give this poll anywhere question to 100 people walking on the streets, and maybe not in Chapel Hill, but in kind of average America, I bet the results would look a lot different. I bet the not at all would be a lot higher. Because I think when you go to the grocery stores now, at least where I live in Raleigh, you just don't see a whole lot of it. And kids are going back to school next week, and no one's going to be wearing a mask, at least at my kid's school. No one's sitting 6 feet apart, none of that kind of stuff, right? So it's still a thing, but I would bet for most people in most situations, in most parts of this country at least, that not at all would be higher. And I think that's kind of the question, right? Is kind of, where are we now? And I don't know that, but what I can hopefully shed some light on is kind of the impact that it has now on patients who are being treated for cancer. And it's funny, I've had a few folks tell me over recent months that have been going through cancer treatment for quite a while, that at the height of the pandemic, as awful as that was for all the obvious reasons, there was a little bit of kind of solidarity, like, what, I have cancer, so I need to be extra cautious about being around people and taking steps. And now, because of COVID, everyone's doing that, right? Most everyone's washing their hands. People are staying masked, staying distant. So everyone's kind of being careful with germs like I've had to be because of my cancer. And there was a little bit of, we were all on the same page. That is changing, right? And so there's some kind of incongruence between this country slowly, haltingly getting back to some version of normal. And if you're being treated for cancer, maybe you're not on that same path, right? So maybe you're not getting back to normal when it comes to exposure and being around people and taking all these kind of safety precautions. And I think that's a real thing, right? So this idea that I'm immunocompromised, I need to stay safe. The world used to be on the same page with me 2 years ago, a year and a half ago. Excuse me, now we're on a much different page. Logistical, right? The access to care, a lot of our work is done via telehealth now, and that has pros and cons. I am seeing folks both in person and here at the hospital and via telehealth, and I can tell you, with few exceptions, most people want to meet with me via telehealth, and that's fine, and that makes a lot of sense. And I think if I could save driving time and save having to park over at the parking deck and pay for that, I think I would do the exact same thing. And at the same time, I've had some folks say that the meeting with not just me, but more importantly, meeting with their oncologist and nurse practitioners and nurse navigators via telehealth sometimes works really well. Sometimes it's kind of hard because they kind of want that in-person contact. And a lot of them, of course, have that. But I think that shift to telehealth has been, like a lot of things with this, had some pros and some things that we've learned from, but also some drawbacks. Staff shortages, of course, here in our clinics at the hospitals, doesn't seem like it's code level red like it has been, but it's, I would say, code level yellow, maybe. I mean, that is still very much a thing. And it's a thing within our group. It's a thing I know in the infusion centers and up on the floors. Between staff shortages and staff turnover, it has really changed the sense, I think, not just from our standpoint as providers, but as for folks who are receiving their care. And the changing guidelines, right? I think we've kind of settled into a pretty, folks can come, can bring family members, can be with them up in the infusion or on the inpatient floors. And you can now even walk in here to the big hospital without having to, kind of say who you're coming to see. So, but for a while there, it was really trying to figure out what are the guidelines, who can I bring with me to the hospital, who I can't. And even though that seems to have settled down some, that is, as we all know, subject to change. And of course, we talked about this some earlier, but the protective measures, right? This is the immunocompromised status for a lot of our patients. And so being cognizant of germs and being cognizant of catching colds was always a consideration. And now when you add catching COVID to that, it's a much larger consideration. So a lot of the folks who I see tend to socially isolate more than I think they would have 3-4 years ago. And I'll get into a couple of vignettes here in a second to illustrate that. But I think for a lot of patients, that's the issue that now in August 2022 is the biggest thing, is how much and how willing am I to expose myself to public at large or to family members who may or may not have COVID. And I'll get into that right after this. Let's go and get into it now. So this is a couple of vignettes here. First one, gentleman who I just started seeing a couple months ago, 76 years old, married to his wife, had been married forever, like 52 years or something. Metastatic lung cancer, does not have a great prognosis, knows this, acknowledges this, can talk about it with me. Historically, psychologically healthy man who I think is probably coping about as well as anyone copes with the situation right now. His issue and how COVID really plays into it is that he and his wife have one adult child and 2 grandchildren who live in Michigan. And they have not seen them since COVID, and since COVID started in March of 2022 or March of 2020. And that was at first because, everyone was isolated. And then, even before he got diagnosed, cancer, even when the world got back to a little bit of normal and he and his wife were vaccinated, his son he and his wife have chosen not to get vaccinated or to vaccinate their children. And so this patient has been, even before he had cancer, reluctant to be around his family, right? He didn't want to be around someone who was unvaccinated. And I think, this is certainly not unique to this family. I think we hear about this a lot. That's why there, of course, are vaccine mandates within our organization and others. But when he was diagnosed with metastatic lung cancer, that's when it really kind of hit the fan, because he knows that his time is limited. He doesn't know, of course, how much, but he knows that it's limited. This is really the closest family he has, is his son, daughter-in-law, and their 2 children. And they're unable, or not choosing not to see them because they remain unvaxxed. And the son, they've had conversations. The patient has asked his son, would you please, and your wife and your children, please get vaccinated so we can see you in person. I don't know how much time I have left. It sounds like those conversations have been respectful, but have not changed his son's decision. And so now this gentleman is faced with the prospect of either, and he doesn't think his son's going to change his mind, so he's either going to never see his son again, or have to make a decision on whether or not he's willing to see someone who's not vaccinated. And, I think, that's hard for the obvious reasons. And it's also hard because you have to really kind of weigh, at this point in August 2022, we can all, catch COVID from people, even if they are vaccinated or if they're not. And I get that there's some risk difference, but, this patient, what we've talked about the last couple of times is whether or not he's comfortable changing his unwillingness to be around his son, because he wants to see his son before he dies. And at some point he kind of feels like, if I'm going to die anyway, then I might as well see him. And if I get it, I get it. But that's not really what he thinks. That's kind of a frustration thought that he has. And so he's really, and we've talked about, and I've encouraged him to talk to his doctors to really get a sense of what is my increased risk to be around someone who's not vaccinated, considering that I can get COVID from someone who is vaccinated. But it's a sticking point that comes with a lot of frustration, to be honest, that his son won't do this. And so this is, with this gentleman, really one way how COVID has impacted his life, and it's going to impact his life until or unless he sees his son and grandchildren again. Really tough case. This next one's a 64-year-old female. She has stage 3 breast cancer. She's currently receiving chemotherapy. She's doing okay from a coping with it, right? She has side effects, but she's kind of doing okay. She has, especially since her cancer diagnosis, been understandably very cognizant about being around people in general, and doing, isolating herself whenever possible, not going to church, not going to large gatherings, doing some outdoor, but it's a little hard in July in North Carolina. And so she's really restricted herself. And what she's struggling with at this point is a fear of missing out, right? She doesn't know what doesn't know whether she's going to survive this. She doesn't know if it's going to, metastasize to stage 4. She doesn't know. So her conundrum right now, if you will, is to think, at what point will I feel safe to be around people and to go back? For her, it's church. Well, at what point will I feel safe to go back to church? And do I, if I have a shortened lifespan, do I want to spend that time not doing things that are meaningful to me and not going to church and kind of missing out on, if I stay in my house a lot, I'm increasing my chances to live longer, but at what cost? And so it's really a balance of risk exposure to COVID versus doing things that are meaningful and important. And there are some places like meeting outside and doing some things where she can feel more comfortable. But large gatherings like church and other things that are important to her, she is not doing and is not sure when or if she'll ever feel comfortable doing those things again. And that's a real loss to her, especially in the context of an uncertain future. So my next poll, that's a very brief vignette. Of course, you don't have all the information on Miss MB, but just curiosity. If you, of what I told you about this patient, do you believe that you would lean more towards staying safe or living life, knowing, of course, that it's not a black and white dichotomous choice? All right, look at this. I wasn't sure where this one would come in either, but it looks like we're getting close to 90% of people would lean more toward living life than staying safe. That's very interesting. Interesting. Yeah, it looks like about maybe 5 to 1, 6 to 1, people are saying live life over staying safe. Very interesting. And again, I know it's not one or the other, but I did want to get a sense where people would lean. And so I think more or less that's been my counsel to her without, telling her what to do. Of course, it's not my role, but I think that's been my counsel to her, right? Is to think about kind of ways that you can minimize future regret. And does that mean living a life that doesn't feel what you want it to be? Or does it mean kind of allowing yourself hopefully a slightly higher risk of getting COVID? She is vaccinated. I think her doctors have encouraged her to get out more and to feel safe. And for my role as a psychologist, it's really kind of hard to figure out, to be honest, whether this is, she's anxious about it, but is it anxiety that's very understandable and normal in this context, or is it anxiety that is somehow clinical in some way? And I think I probably lean more to the former, but next time I see her, I may tell her that I put this question out to however many 100 people and that 85% of them said that she should live life. No, I probably won't tell her that, but maybe I will. All right, but that's interesting. I appreciate everyone kind of logging in for that. And so that kind of gets at, I know we're getting toward the time we're going to ask some questions or open up for questions, but, really that's the question, right? How to enhance people's coping and living a life that's meaningful to them during a pandemic. And I think it really is weighing to what degree you're willing to risk getting COVID. And really, I've counseled a lot of people to avoid kind of getting misinformation that they get from social media or certain news channels. And then, I clarify, I'm not a medical doctor, but I feel comfortable batting down some of the ideas I've heard. Encourage them to talk to their oncologist, right, to really kind of get a sense of just what they're risking, get a sense of how immunocompromised they are, how long they will be. A lot of variables that go into that. And an honest discussion with the oncologist, primary care physician, nurse practitioner, nurse, really nurse navigator, certainly, and to really kind of cut through what is misinformation, what is anxiety for anxiety's sake, and really kind of make a sober evaluation of what my risk is and how much I'm willing to risk it to live a life that's meaningful to me. And some other things I think are probably not specific to COVID, but are probably more important during the pandemic, right? And that's lean on others for support, even if it has to be virtual or in a support group. Certainly for everyone out here who doesn't know about us or think about us here in the CCSP, we are available to meet with folks, of course, for counseling, supportive services, medication evaluations, and COVID doesn't dominate the content of my sessions like it used to, but it's still a thread for a lot of people. And something I do for folks, I think honestly, one of those valuable things I do for the patients I work with is to normalize what they're going through, because in most situations, what they're going through is pretty normal and pretty understandable. And I joke that you may not want to be called normal by your your spouse or your husband, but being told you're normal by a psychologist kind of seems like a compliment, I guess. And I think having some anxiety about this and about COVID and about what it means with, catching something that's going to decrease your quality of life or maybe even, get you in the hospital, that's an understandable anxiety, and normalizing that and talking about that and processing of that, I think can bring some clarity to some folks. And also, I'm always hesitant to try and put any kind of Pollyannish spin on this, but there are growth opportunities in all kinds of trauma and all kinds of difficult situations, and I don't think the pandemic's any different. And that's not to discount the negative and the heartbreak that so many people have experienced. But sometimes it's helpful to point out how individuals and how maybe we as a group have grown as a result of the trauma we faced with the pandemic. So I try to make a point to point that out as well. All right. First of all, an apology again with the audio problems. I appreciate everyone sticking with me through that. I know that was not easy, and we kind of had to get through a couple of those slides a little quicker than normal. But I'd love to open up to any questions or any comments people have.
All right, Dr. Yopp, thank you so much. And I'm just going to remind everyone they can go to that poll everywhere and go ahead and submit those questions, and we'll pop them up on the screen as they come in. Boy, some really challenging situations that you're dealing with. One thing I was curious about, are there resources, authoritative sources that you like to recommend to your patients when they're struggling with sorting some of this out, and with so many things to read and so many pieces of conflicting information?
Yeah, there are. I mean, you certainly, you can go to the CDC and kind of get the latest, but that's really, and cancer.org has some nice resources, but it really is such an individual thing that I think talking to someone on your care team to get a kind of individualized assessment of your risk, I think that's really needed for folks who are really struggling with this. Like the gentleman I talked about who's doesn't want to be around, or doesn't want to see his son because his son's not vaccinated and won't get vaccinated. Like we talked about, I was like, really think, as opposed to listening to me or seeing whatever you can find online, talk to your doctor, talk to or someone on your care team and say, here's the situation. I really want to be around this person, especially given my life expectancy, but they are unvaccinated. What is my, if I'm smart and if we wear masks or if we try to meet outside, or even if we don't, at what greater risk am I for acquiring COVID from them compared to other people who I am around who are vaccinated? And so I think, that's, we don't want to flood care team members with kind of, queries about this from their patients, but I do think that that's where the best information that you're going to get from. And I think that, talk to them, kind of what is your A&C, all that. I mean, really kind of get an idea of how vulnerable you are to this. And, to put it bluntly, kind of how much worse would it be for me to get COVID compared to someone just on the street? I think that's such an individualized answer for so many people, that really talking to someone who knows you, knows your care, knows your numbers, is the best place to get it.
Yeah, that makes a lot of sense. Want to remind
that, and as I mentioned earlier, that and there's, I mean, there's just so much misinformation out there, and I again don't want to. I'm not a medical, practitioner, but some things I feel pretty comfortable kind of batting down. And so that it's not just a matter of kind of getting the right information but also not listening to the wrong information.
Yeah, good point. All right, we did have a question just come in, and we do have a few more minutes for questions if others would like to submit them. How often do you hear patients with advanced diagnosis undergoing treatment primarily to make their family happy rather than because it is what they want?
Pretty often, I guess is how I would say that. I can off the top of my head think of a couple of patients right now, including one who's a older adolescent who's stated very clearly that he's doing this for his family. So that's not uncommon, right? That people draw on kind of external motivations for going through something that's really challenging, right? It's not just that I want to live, but it's that I don't want to die for other people. And sometimes I think that's the case. I think sometimes it's a little more it's a little, I don't want to say, I can't find the right word. It's not easier, but it's a little more palatable to kind of do this for other people sometimes. And I think there might be some folks who believe and who are doing it for others, that if those others kind of gave them permission not to do it, they still might want to do it too, right? But it's kind of it's a little bit easier, or it feels a little better to think of doing it from others. But for those people who are going through unnecessary, or not unnecessary, but going through treatment that they would not otherwise do and are doing it solely because they feel guilty or because family members have guilted them into it, that's a different matter, right? That's really worth a discussion, often with those family members or with people to say, let's think about what you as a patient want. This is your life, and doing things for others that might be a nice gesture, might be magnanimous in some way, but let's really put that on the table. And sometimes it means talking to the others about family members about letting that person make his or her own decision. But that's a complicated dynamic that can be teased out, and when it is, it's a good thing. But yeah, so I think we see it, I would say, pretty often, not all the time, not in most situations, but it's not uncommon.
Well, those patients and their families are fortunate to have you there to help sort those things out. We have, looks like, time for one more question. Really interesting point regarding parallels between cancer diagnosis and COVID pandemic. Made me think about how that compounded for people. Great presentation. Thanks. I guess it's more of a comment. And then one more. Here we go. Has the pandemic caused issues with grieving during closed funerals, etc.? Great question.
Yes, it sure has. And I mentioned earlier, I think that one of the first patients I saw when I came back to the hospital in May or June, he died without being able to see his wife and in person again. And she's currently in a grief support group that I co-lead. And she and others that are in this group talk about how whether it was that situation, which was really stark, right? She couldn't be around her person as that person was dying. That happened to a lot of folks in this country, whether it's nursing homes or hospitals or other situations where people were not with their loved ones at a time when they would want to be. And then to this point, more explicitly, the rituals and the grieving rituals that most of us, that we have in our society, in our subcultures, those were completely disrupted, right? Funerals, all those kind of things were way out of whack. And that absolutely disrupted grief. And I think it has left some people feeling that their grieving was not unfinished, but missed an important milestone, right? Missed having a funeral where you hear from others how much they love that person, or where you can greet people at a wake, or those kind of rituals that we do and we've carried on for so many years because they are helpful and they are soothing, that those were just missed out on, has been a real thing, and something that everyone in our grief group who lost someone during the height of the pandemic has talked about. None of them lost their loved ones to COVID, but but their grieving rituals that they think they would have done otherwise were completely upended because of COVID. And it's worth taking note of when your grief is interfered with at the beginning, what the long-term effect of that is, which is certainly beyond what we don't have any time to talk about. That's just 101.
Right.
That's a fantastic point that was raised.
Yeah, a whole nother topic. How do you find closure when the most typical way to get that closure is not there? This has been great, Dr. Yopp. Thank you so much. I want to say a couple of other thank yous. Thanks to the people of North Carolina for their generous support of Lineberger and the University Cancer Research Fund. Thank you to the team, Mary King, John Powell, Jason Paler, Veneranda Obore, Oliver Marth, and Andrew Dodgson for all the hard work that they do to make every one of these lectures possible.